Hi, my name's Alexis. Today I'll be talking about diazepam for my 5-minute video. So just for some background on the drug, this is a benzodiazepine, generically called diazepam, and the brand name is Valium. It has many off-label uses such as insomnia, restless leg syndrome, pre- and post-operative sedation, but it is most commonly used to treat anxiety, alcohol withdrawals, and seizures. It's a Schedule IV controlled substance, which indicates that the government considers this drug to have a real potential for abuse and dependence. It is among the most successful drug from the onset of the pharmacological revolution that began in the 1950s. Here we can see a couple of photos of the structure of the drug. It is a colorless to light yellow crystalline compound, insoluble in water. The empirical formula is C16H13Cln2O. The molecular weight is 284.75, and Valium is available in 2 milligram, 5 milligram, and 10 milligram tablets. The synthesis was first reported by Sternbach and Reeder at Hoffmann-La Roche Pharmaceutical Company in 1961. They were tasked with creating a safer alternative to barbiturates, and over the course of many years, they did not have any success. But one of the compounds that they labeled it RO5-0690 was placed on a shelf and then had forgotten about for many years. During a lab cleanup several years later, the compound was tested and showed to have exactly what they were looking for. It was originally named chlorodiazepoxide and later introduced to the US. Valium was launched in 1963, and for most years until the patent ran out in 1985, it was the highest selling drug in the United States. After it became generic, the cost plummeted. In the US, it now costs about 40 cents per dose, but it can be bought for the equivalent of a penny per dose in some other countries. Diazepam is synthesized by cyclocondensation of glycine ethyl ester hydrochloride to form the benzodiazepine core, followed by alkylation of the one-position nitrogen via dimethyl sulfate and sodium methoxide and methanol at reflux. Diazepam is also synthesized from norodiazepam by methylating the R1 position using dimethyl sulfate. So how it works is the diazepam increases the effect of sedation, muscle relaxant, and anticonvulsion. Most of these effects are thought to result from the production of GABA-aminobutyric acid, so-called GABA, that is an inhibitory neurotransmitter in the central nervous system. Once someone has become physically dependent on benzodiazepine, coming off the drug is accompanied by withdrawal symptoms, and the risk is more pronounced in patients who have been on it long term. Some of the symptoms may consist of tremors, abdominal and muscle cramps, vomiting, sweating, headaches, muscle pain, extreme anxiety, tension, restlessness, confusion, and irritability. In some of the more extreme cases, symptoms have been depersonalization, numbness and tingling of extremities, hypersensitivity to light and noise, physical contact hallucination, or seizures. So, a couple interesting facts about the drug is Stevie Nicks, the former lead singer of Fleetwood Mac, said in an interview that she was prescribed benzodiazepine while in rehab for her cocaine use, but then became physically dependent on the prescription drug and was addicted for 8 years. She said it took her 48 days to detox from the medication when she became sober. And because this is a controlled substance, any possession of diazepam without a valid prescription can result in a felony. And according to the DEA, diazepam is one of the top prescription drugs found on the black market, usually due to unethical doctors and pharmacists who unregulate purchases on the internet.